Jasmine Suite, which is part of our larger gynecology unit that encompasses both the gynecology inpatient ward but also this diagnostic area. And the reason I'm here is I am celebrating, along with the whole organisation and I hope the NHS and the people that are served, a fabulous award of an OBE for Jill Clark, who is our lead gynecology nurse. Jill is absolutely stepping hill and represents us through and through. She's worked here for 37 years and she has brought this unit on leaps and bounds. She's allowed women to have diagnostics that are done on an outpatient basis, whereas previously they'd have had to actually stay overnight. This particular unit sees over 100 women a week for things such as smears, but sometimes for slightly more invasive diagnostic procedures to help ensure that they have the very best and most appropriate care thereafter. Jill is a shining example of what every healthcare professional should be, and I hope very much that when she gets her award from the Queen, we're hoping maybe in the autumn, that she will be there representing our organisation and the people of Stockport down in London. We're so proud of Jill. Thank you to her and the care that she's given. The Board of Directors at its recent meeting discussed and approved the 5-year strategy for this organisation. And whilst it's about this organisation, it can only be in a wider context of working with our partners. In Greater Manchester, we're already doing work under the Healthier Together programme, but more locally within the southern sector, we're working with a combination of commissioners and providers across South Manchester, Tameside, East Cheshire and Stockport to actually consider how we could best serve patients by working together, jointly providing services for that wider population. So it was good to have the strategy approved. What we now need to do is actually take that strategy out to our stakeholders and to our partners to share with them our aspirations, our aims and our issues. And so I hope that in the coming weeks and months we will be able to share that with yourselves. I think I've talked to you on each of these podcasts about accident and emergency and the challenge that we as an organisation face with this. This became an unprecedented challenge in June when we saw 13% more people, that's about 35-40 more people per day coming through our doors for the whole of June. Now, many of those people were entirely appropriately to be seen in accident and emergency, and we were able to either treat some kind of injury there and then, or else actually refer them into the hospital or for other ongoing care. However, we are still seeing too many people who could otherwise go to their local pharmacy, to their local GP, to wait for an appointment and instead choose to come to accident and emergency. And that means the people who really do need our services are delayed. What we are doing, however, to treat those numbers is to actually further extend our services. Our A&E emergency nurse practitioners are going to extend their hours. We've got a GP who will be working in accident and emergency to see those conditions that really should have been seen in primary care. And we're continuing to work with partners such as North West Ambulance Service, Mastercall, the out-of-hours doctors service, and our local primary care GPs to improve wherever possible the services outside the hospital so that those become the choice instead of coming to the accident and emergency department. I'd very much ask for your help with this. It's important that we provide the first line of treatment for those that really do need our care, but to not necessarily have those coming to us that don't. Thank you. Patient safety and quality of care continues to be the absolute top priority for our organisation and the NHS. And more work is being done around these areas. In order to share the kind of work that we're doing, we're really pleased that the NHS has chosen to launch on the NHS Choices website some more information about patient safety matters. One of the new areas that are being looked at is the nurse staffing levels on each of our wards. And what we are now doing is actually providing detailed information about the planned staffing levels and the actual staffing levels. This is to hopefully give confidence to those people who use our services about the safety aspects within the organisation. What is then done is against a number of other patient safety indicators. These are rated as green, meaning fully covered and compliant, blue, where there is some improvement to make, or red, where there is significant improvement to make. I'm pleased to say that out of the 6 indicators that we got, we have only 2 blues and the rest are green. And the information around those specific indicators are being shown for you on the podcast. We have a new carers information point in the hospital. This is located in the entrance of the Poplar Grove entrance, which is quite close to the main entrance of the hospital. The idea of this is it will give advice to younger people and older people around benefits, how we can help support carers, how we can support those that need care. It's a huge issue within Stockport and the surrounding area, and in the last year alone it's estimated that the unpaid carers bill would come to something like £570 million. As somebody who already is involved in some caring with my husband for his mother, it will be a really rich source of information, and I'm sure both I and others will benefit from the information it gives. Another new venture is a pharmacy shop, which is currently in the process of construction and we hope will be opened late August, early September. This will provide over-the-counter medicines for our outpatients, for people who have perhaps visited the accident and emergency department, but also for any visitors and staff. We hope that this will be a facility that is well used and will allow us to provide a faster, more efficient service to those who are collecting their medicines. And finally, an invitation for your diaries. If you haven't already seen our excellent coverage of our Back to the Future open day on the 19th of July, then I'm surprised because it's been very bold and colourful, and I hope that you have seen some of the promotional material. I really do invite you to come and spend the day with us between 10 and 2 on that Saturday. We've got over 50 different stalls giving information about what we're doing, but there are also dance, music and other activities in the hospital site on that day. I look forward to welcoming you there, and thank you to all of those who have provided sponsorship.